Hey, GLP-1 plus size community. Before we jump into the podcast, please take the time to leave us a 5-star review on whatever audio platform you're listening to the podcast on. Share your story and how the podcast has helped you. This will help us get referred up in the audio platform so that we can reach more people that need our help, our support, and guidance from our doctors. Help us get loud and change things. Are you interested in understanding GLP-1 medications like Ozempic, wegovy, or Mounjaro? Then join us on the Plus Sides Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The Plus Sides podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, wegovy, and Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to the Plus Sides Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together, because every story deserves to be heard. Every life deserves to shine, and everyone deserves access to expert knowledge and medication. The Plus Sides Podcast. You're not alone. It's not your fault.
"20 seconds a week to lose 20% of your weight in a year with diet and exercise." That's the power of GLP-1s through Ro. Ro helps find the medication that's right for you, based on cost, availability, and your weight loss goals. Losing weight with GLP-1s is possible through Ro.
Hello, how are you?
What's up?
I'm fine. Thank you for having me back. I guess you didn't learn your lesson the first time.
I guess not. Clearly.
Look, no.
Or maybe I
didn't.
did learn it and I just want you to come school everybody again, you know? This is Mad Endo on TikTok, also known as Dr. Melissa Young, who has come to hang out with us. She's an endocrinologist and knows a lot about the disease of obesity, PCOS, all the things. And we're going to talk about all that today. And I'm just so glad to have you. But for those who don't know you, can you tell us a little bit about you, like what you do and how you help people?
Sure. I am, as Kim said, I'm an endocrinologist. I've been in practice, I'm not sure I want to say how long, for over 20 years. I do general endocrinology. There are some endocrinologists who will specifically just do pituitary or just do thyroid, but I do general endocrinology. So although the majority of my patients do either have diabetes or thyroid disease, but I also see people with other hormonal disorders, low testosterone, pituitary disorders, adrenal, and so on.
Right. Okay.
I don't specifically treat weight loss or treat obesity as a separate thing, but many of my patients, they come in and when I ask them, have you been since last time? One of their first complaints is, well, I gained more weight. We kind of end up on that path many times.
What I'm noticing is that a lot of times people are like, what kind of doctor do I go to for these medications? And in my research and, experience thus far, it seems like to me that these medications are complicated and they're not always easy to dose. And the disease of obesity and all these related disorders are very complicated as well. So sometimes you can't always get care from a GP where they may know about these things to properly handle, your care on this journey, which is long, and so and you can tell me what you think, but it seems like bariatric doctors, endocrinologists, and obesity specialists seem to understand them best. And so I would like to know a little bit about what is an endocrinologist? What are you actually looking for in the body? What is your expertise in that area? So we can understand what that means.
So endocrinology is the branch of medicine that deals with hormones. And a hormone is, most of the time when people think of hormones, they only think of estrogen and testosterone. But a
Yeah.
hormone is a substance that's made by a tissue in the body that travels through the bloodstream and affects other organs. So, as opposed to, say, a salivary gland. The salivary gland, there's a duct, and the saliva goes into the mouth. And so that's not a hormone. But insulin is secreted by the pancreas. It goes through the bloodstream and it affects many organs. And so that is considered a hormone. So we treat it, again, in general endocrinology, we treat many different hormonal disorders. There are, sometimes people ask me for me to check, quote unquote, all their hormones. And I said, I can't do that because there's hundreds. And so when we check hormones, we need to know which one we're checking and why, because there are, depending on what the symptoms are, there are different things we're going to look for.
Yeah. Yeah. That makes total sense. In terms of like the endocrine system, how is that connected to things like preventing stroke or heart disease and things like that?
So that's kind of a complicated question because
That's okay. Tell me.
because hormones affect a lot of different organs in the body.
Yeah.
So there are many endocrine disorders that can have an impact on atherosclerosis. Primarily, just from a number standpoint, a prevalence standpoint, diabetes is going to be a very high risk factor. It's actually considered a heart disease equivalent because people who have type 2 diabetes are at very high risk of developing atherosclerosis, blockage of the arteries, and so that increases the risk of heart attack and stroke. But there are other, endocrine disorders that increase that risk as well. And just having the disease of obesity, because it, and people don't think of obesity as a hormonal disorder, but it is, because again, we're talking about, the hunger and the satiety hormones, ghrelin and leptin and so on. And when the fat cells, when the adipose cells fill with lipids, with fat, they secrete these pro-inflammatory substances, and that increases also the risk of developing atherosclerosis. And again, it's that blockage of the arteries that increases the risk of heart attack and stroke.
Food has definitely been a very dominant voice in my head. That's not the main focus anymore. Dieting, exercising, and adding GLP-1s through Row is a game changer. I have such a sense of mental freedom since I started with Row. Food no longer controls my thoughts. Family time used to revolve around food, and now it revolves around what we're gonna go do together.
I know recently you had talked about Novo Nordisk, and I remember seeing a TikTok about it where you were talking about like how it has like helped with, well, it was like a study, and it was a big study. I think I remember. And you were talking,
trial?
yeah, where they were specifically,
so the select trial looking at semaglutide 2.4 milligrams, so wegovy at the highest dose. There's, I think, 17,000 people in the study, and it was placebo controlled, which means that a certain number of people were on wegovy and a certain number of people were not. They were on placebo. And when they looked at, and these are people who had known heart disease, when they looked at the incidence of what's called MACE, major adverse cardiovascular event, so that's death due to cardiovascular disease, heart attack, and stroke, the people who were on semaglutide had a 20% decrease in their risk. So,
that's huge.
and when you look at weight loss by other means, people who diet and exercise and able to lose weight, or even looking at bariatric surgery, there is a decrease in MACE, but not 20%. So there's something else that this drug does that decreases the risk of cardiovascular events.
That's
And
amazing.
then isn't there
We
GLP?
had that data with Ozempic already years ago.
Yeah.
We already knew that, and that's at a lower dose. I think that like
Yeah.
a 26% decrease or something in the study that they did for that. So this is not a surprise at all.
How can years of yo-yo dieting affect your endocrine system? Impact, effects, things like that. Because
Well,
that's where we're all here for that.
Also, when someone gains weight, again, there is an impact on those hunger and satiety hormones. And so people who are overweight or who have obesity, when they feel like their body's fighting against them, when they try to lose weight, they're not imagining that. That is true. They are hungrier. It takes more food to make them feel full. And this is, particularly true also in people who have type 2 diabetes because of the insulin resistance. And when people have insulin resistance, when they have type 2 diabetes, the other hormones that are affected is GLP-1, the incretins. So the body becomes resistant to GLP-1. And so GLP-1 is supposed to help you make more insulin when your blood sugars are high, and help with satiety. But their body doesn't respond to the amount that their body is making. And of course, there's a decrease in insulin, there's an increase in glucagon, which leads to the abnormalities in glucose. So there are many hormones that are affected by weight gain. And then when you try to lose weight, again, there's this dysregulation in the hunger hormones, which makes you feel the need to eat more. So when people are faulted for their lack of willpower, it's a brain thing. It's a hormonal thing. It's not that intellectually, these people know that they shouldn't eat as much. But they have this need to do so. Their brain is telling them that they need to eat.
What truth was it to those infomercial pills that said they would reduce your cortisol and your belly would shrink? If there was truth at all.
If there was truth, then we wouldn't need wegovy. While it is true that excess cortisol causes weight gain, the amount of cortisol that you can make physiologically, unless there's something actually physically wrong with your adrenal gland or with your pituitary gland telling your adrenal gland to work harder, you just can't make enough cortisol to be the sole cause of the weight gain. Having said that, there are some physiologic things that happen. So people who are shift workers, people who have to work at night, because their daily normal cycle of cortisol production is thrown off, they do have a harder time losing weight. People who have sleep apnea, again, because they think they're sleeping, but their brain keeps waking up because it's trying to keep them breathing. Again, their baseline cortisol levels are higher, so they also have a harder time losing weight, which is a vicious cycle because the weight gain increases the risk of sleep apnea. The sleep apnea makes them gain more weight, and so on.
Yeah.
But these pills that are available that allegedly lower your cortisol, no.
No.
The short answer is
Sugar
no.
pills. Oh, wow. See, don't buy that stuff off infomercials.
"20 seconds a week to lose 20% of your weight in a year with diet and exercise. That's the power of GLP-1s through Ro. Ro helps find the medication that's right for you, based on cost, availability, and your weight loss goals. Losing weight with GLP-1s is possible through Ro.
Are you interested in understanding GLP-1 medications like Ozempic, Wegovy, or Mounjaro? Then join us on The Plus Sides, Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The Plus Sides podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, Wegovy, and Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to The Plus Sides, Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together, because every story deserves to be heard. Every life deserves to shine, and everyone deserves access to expert knowledge and medication. The Plus Sides Podcast. You're not alone.
it's not your fault.